Welcome to the online Overdose Responder Training Program sponsored by Long Island Medical Training and Consulting, a division of Have Dummy Will Travel Incorporated. I'm Eric, the Chief Emergency Expert, and it is my pleasure and distinct honor to be your host throughout this program. Completion of this training class gives you the legal authority to carry naloxone, also known as Narcan, and administer it to a person whom you believe is experiencing an opiate-associated life-threatening emergency. This online training class and the naloxone emergency kit is completely free of charge. Upon completing all modules of this training, you will be asked to take a short test and register for the kit. You will then be able to pick up the emergency kit at our office located in Miller Place during normal business hours. If you prefer, the kit can be mailed to you for $9.95 to cover shipping and handling fees. This class is specific to New York State and cannot be used for certification in another state. Likewise, the emergency kit cannot be shipped to an address outside of New York State. The certification is good for 2 years. Thank you for your willingness to respond to an emergency and possibly save a life. The New York State Commissioner of Health has issued standing orders for the use of Narcan by citizen first responders like you. The law requires, however, that prior to administering Narcan, a person must go through a training program similar to this one. This program is compliant with Section 138 of Chapter 10 of the New York Code of Rules and Regulations, Article 80, and Public Health Law Section 3309, and is given as a harm reduction strategy intended to save one life at a time until a victim can receive proper mental health care and counseling. The philosophy is similar to providing IV drug users with clean needles, or providing middle school students with condoms. We know that we cannot completely stop these behaviors, but we can attempt to prevent disease transmission and unwanted pregnancies. It is important to note that this strategy is only one of several ways our community needs to manage the rampant opioid abuse problem. Opiates are any pharmacological substances derived from the poppy plant. These include medications that are often prescribed for pain. At relatively high doses, an opiate can give the user a sense of euphoria, causing him or her to feel high. This opens the door to addiction and abuse. Opiate medications include oxycodone or oxycontin, hydrocodone or Vicodin, morphine, codeine, Percodan or Percocet, fentanyl or Duragesic, hydromorphone or Dilaudid, and methadone. Heroin, an illegal drug, is also a strong opiate and is relatively inexpensive to obtain on the street. It is easily self-administered by injection into the veins of the body or by snorting through the nose. Many of the opiate overdoses we see are from the misuse of heroin or other legally obtained pills. Many drug dealers are cutting heroin with synthetic opiates called fentanyl. Fentanyl is 50 to 100 times stronger than heroin and goes by street names like Theraflu, Bud Ice, Income Tax, and Breaking Bad. By adding fentanyl, or one of its many analogs, dealers are able to create a supercharged experience for their clients. Unfortunately, those mixtures are not exact or consistent, contributing to numerous fatalities across the country. Another synthetic called carfentanil is also showing up on the street. Used as an elephant tranquilizer, carfentanil is 100 times more powerful than fentanyl. Just 2 milligrams of carfentanil powder is enough to be lethal to a human. Again, there is no consistency in the amounts of carfentanil being distributed in a dealer's product. It is important to note that any opiate powder can enter your body through inhalation or absorption through the skin. For your own safety, never handle any residue or remnants that you may find near a person using opiates. If you must handle these items, do so only while wearing medical exam gloves. In most cases, overdoses are not intentional. Overdose is more likely to happen to experienced users, especially when they had been clean for a while. Perhaps this clean period was during a detox or rehabilitation attempt, hospital stay, or incarceration. While using, an addict builds up a tolerance for opiates over time, and often find themselves needing greater quantities at once in order to experience a high. The addict loses his or her tolerance for the drug while clean, and during a relapse, they make the mistake of using the same amount he or she needed to get high prior to the clean period. It is important to note that relapses are a part of the recovery process and should be expected in anyone who is trying to recover from addiction. Other risk factors for overdose include mixing opiates with other drugs. The Suffolk County Medical Examiner reports seeing 6 or more illicit substances in toxicological tests performed on suspected overdose deaths on a regular basis. It is also suggested that there may be several additional substances that degrade quickly in the body, and so may not show up by the time a sample can be collected. Also, consider that when police arrest a dealer, addicts will find another supplier. The product from this new source may have a more potent heroin-fentanyl-carfentanyl mixture. Not having any way of knowing this, the addict may use much more than they need to in order to achieve a high. Risk of overdose is also increased when a user has a serious underlying disease such as HIV or AIDS, liver disease, diabetes, or heart disease. Since no one is there to call for help or administer naloxone, the risk of overdose increases when a user uses while alone. The following video is a report from a Lowell, Massachusetts news station. The content of the report highlights an issue we are seeing all over the nation, including in New York.
Appleton Street, Lowell, the city's opioid alley. Old-timers call it the Street of the Walking Dead.
You ever watch the movie? They're the same way. They sleep while they're walking and they fall asleep anywhere.
The ravages of addiction at every turn.
I've lost 15 friends in the past 6 months.
How about yourself?
I've overdosed 3 times. So it's brutal.
Into this plague, waging hand-to-hand combat, Billy Path.
And let me tell you, I almost didn't go if it wasn't for your help.
Founder of a group called Heroin is Killing My Town, this day like all others.
We do about a half dozen to a dozen people a day I put in a treatment. And that's the easy part.
The hardest part, the lethal deluge of fentanyl, 50 times more powerful than heroin.
I call it one shot, one kill. You use fentanyl once intravenously, you got about a 5% chance at your life. That's how deadly it is.
Today, Billy was driving this fentanyl user to detox again. He usually leaves after a couple of days.
You get major sweat, shakes, you get anxiety. The worst part, though, is the anxiety. That is what makes us run back out there.
A demoralizing battle.
Our epidemic has intensified and doubled with this fentanyl. I'm not having any luck with getting people to overcome on fentanyl.
Despite all the attention, the opioid epidemic is only getting worse. The death toll rising with fentanyl at the heart of the surge. Advocates are calling for more beds and more intense treatment. Pay now or pay later. In Lowell, Jorge Quiroga, WCBB News 5.
While naloxone is effective in reversing opiate overdoses, we are finding that more and more is needed to accomplish this successfully. It is also important to know that Narcan does not work on non-opioid sedating drugs, such as alcohol, benzodiazepines like Valium, Xanax, or Klonopin, clonidine, Elavil, Y-hydrobutyric acid or GHB, ketamine or K2 or spice, a synthetic marijuana. Narcan also does not work on stimulants such as cocaine, amphetamines, methamphetamine, ecstasy, MDMA, or Molly. Opiates bind to the receptor sites on the brain that control normal breathing function. This causes breathing to slow, and if taken in great enough quantity, breathing will eventually stop. When breathing slows, oxygen levels in the blood decrease, and carbon dioxide levels increase, causing the brain and heart to sustain damage. Eventually, the heart stops altogether, leading to death. Overdose is not an instant phenomenon. Instead, it is a process that usually takes between 1 and 2 hours for death to occur. For a rescuer, this means that there is time to act, but no time to waste. With the right tools, most opiate overdoses can be reversed, and many deaths and permanent brain injuries can be prevented. If you encounter a person who is unconscious, you should suspect that he or she is suffering from an opiate overdose if you see 2 or more of the following signs. The person has a heavy head nod or is not responsive to stimulation. The person has slowed or shallow breathing. The person's lips and or nail beds are turning blue. The person has extremely small pupils in both eyes. Let's look at each of these signs in a little bit more detail and see how they may all fit together. A person who is unconscious with his or her chin down or who appears too sleepy to keep their head up is in a dangerous position. This can lead to a partial or complete airway obstruction, reducing the volume of air moving into the lungs. If you find an unconscious person, roll him or her onto his or her back and do a head tilt chin lift to open up the airway. Tap his or her shoulders while shouting his or her name and shout, "Are you okay? Are you okay?" If there is no response, rub the person's sternum, pinch the webbing between the person's thumb and forefinger, or push and roll the barrel of a pen down against his or her nail beds. The idea here is to check to see if he or she is responsive to painful stimuli. If there is still no response, check for breathing by looking for his or her chest to rise and fall. If the victim is not breathing at all, immediate intervention is needed. If breathing is present, but at a rate that is less than 10 times per minute, or once every 6 seconds, there is strong evidence for opiate overdose. Check the person's lips and/or nail beds. Bluish skin is a sign of a low oxygen level in the blood. This is especially likely in people who have not been breathing adequately for an extended period of time. If you see bluish lips or nail beds in an unresponsive person, this is even stronger evidence for opiate overdose. Look at the person's pupils. Normal pupils may be small in sunlight, as shown in the top picture. However, opiates cause pupils to look extremely small, perhaps the size of a pinpoint, as can be seen here in the bottom picture. Check that both pupils are about equal in size and significantly smaller than usual, as unequal pupils may be a sign of a head injury. It is important to note that pupil constriction may not occur if the opiates were mixed with a stimulant such as cocaine. The strongest evidence for a victim of overdose is slow, shallow breathing with bluish lips and/or nail beds, and pinpoint but equal pupils in a person who is unresponsive to painful stimuli. This is a life-threatening emergency. You must call 911 and administer naloxone to this person as soon as possible. Don't be afraid to call 911. New York's new 911 Good Samaritan law encourages people to seek help and avoid leaving overdose victims to die in their beds or in remote areas, away from law enforcement, for fear of getting in trouble. To this end, the Good Samaritan law in New York provides protections for the victim and those who seek help during an overdose from charge and prosecution for drug possession of up to 8 ounces of narcotics, what would constitute an A2 felony offense, alcohol possession by underage drinkers, possession of any amount of marijuana, or sharing drugs, which normally constitutes a sales offense in New York. The Good Samaritan law does not provide protection for parole violations, outstanding warrants, other crimes on the scene, such as weapons or stolen goods, and child protective services and housing issues. Naloxone, or Narcan, is an opiate reversal agent that has proven itself to be very safe and effective over the past few decades. Narcan works by stripping the opiates off of the receptors on the brain and taking their place, blocking reattachment. This reduces the effects of the opiates on respiration and terminates the high feeling, usually in about 3 to 5 minutes. Narcan can be safely given to adults and children. Since this is the only action of Narcan, accidental administration to a person who is not experiencing an overdose cannot cause any harm. The only side effect of Narcan is withdrawal from the opiate, including nausea, vomiting, and restlessness. Withdrawal symptoms will usually subside after about an hour. Traditional administration of Narcan has been through an IV, or a shot in the arm or leg. Now, naloxone is available as a nasal spray. This route is painless, and absorption is quick enough to be effective in reversing opiate overdoses. Removing a needle from the delivery system allows injections to be done safely by everyday people who have little or no medical training. Since everyone's nose is easily accessible, there is no need to worry about exposing skin on an arm or leg to find an injection site, especially in the wintertime. While Narcan is a life-saving tool, it may not always be enough. In addition, it is possible that you may not have enough Narcan in your kit to reverse an overdose. Therefore, your first priority must be to call 911 for help. In addition, it may also be necessary to administer CPR to an overdose victim who has completely stopped breathing. Without CPR, the naloxone may not circulate throughout the body, including to the brain where it is needed. Therefore, you are strongly encouraged to learn hands-only CPR at minimum and urged to attend a class that will lead towards certification. A link to our CPR class schedule is available at the end of this presentation. The Overdose Prevention Rescue Kit consists of a barrier mask for rescue breathing, 2 Narcan or naloxone delivery devices, 1 pair of non-latex gloves, 2 New York State Department of Health reporting forms, 2 alcohol prep pads, and 1 certificate of completion card legalizing your possession of a prescribed medication. Like any medication, naloxone has an expiration date. You can find this date on the side of the box the medication is packaged in. Also note, Narcan should be stored away from temperature extremes and light. Administering this form of Narcan is very simple. First, remove the delivery device from its blister pack by peeling back the tab with the circle. You must not test the device, as this is a single dose unit. Next, position the victim on his or her back and tilt his or her head back. This opens the airway to help breathing and positions the nasal cavity to receive the naloxone. Place 2 fingers on either side of the nose cone and your thumb on the plunger. Insert the device into either nostril until your fingers are touching the person's nose. Press the plunger firmly and remove the device from the nostril. If after 3 minutes the victim is still not breathing and awake, administer the second dose of naloxone in the same manner as the first. This time you will use the opposite nostril.
Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. Please see indications and important safety information at the end of this video. Also, please see accompanying full prescribing information in the use of this product. Narcan nasal spray is an emergency treatment for a known or suspected opioid overdose. The appropriate use of Narcan nasal spray can help you save a life. Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders and shout their name.
Kevin.
Ask if he or she is okay.
Hey, can you hear me?
Check for signs of an overdose, unresponsive to touch or voice. Breathing is slow, uneven, or has stopped. Snoring, gasping, or gurgling sounds. Fingernails or lips are blue or purple. Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open it. Remove and review the printed quick start guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. After you have given this medication, seek emergency help right away. Narcan nasal spray is not a substitute for emergency medical care.
I'm with somebody who stopped breathing. I think they've had an overdose.
Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new Narcan nasal spray to give an additional dose in the other nostril. Acute opiate withdrawal symptoms may occur from use of Narcan nasal spray in patients who are opioid dependent. Symptoms include body aches, diarrhea, increased heart rate or tachycardia, fever, runny nose, sneezing, goosebumps, also known as piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness, and increased blood pressure. When the emergency is over, put the Narcan nasal spray back in its box and throw it away in a place that is away from the reach of children. In addition to watching this video, please read the quick start guide that comes with Narcan nasal spray before using it. Talk to a healthcare professional if you have any questions about how to administer Narcan nasal spray. Please read the indications and important safety information that follows. Store Narcan nasal spray at room temperature between 59 to 77 degrees Fahrenheit, 15 to 25 degrees centigrade. Do not freeze Narcan nasal spray. Keep Narcan nasal spray in the box until ready to use. Protect from light. Replace Narcan nasal spray before the expiration date on the box. Keep Narcan nasal spray and all medicines out of the reach of children. Indications. Narcan, naloxone hydrochloride nasal spray, is an opioid antagonist indicated for the emergency treatment of known or suspected opioid overdose, as manifested by respiratory and/or central nervous system depression. Narcan nasal spray is intended for immediate administration as emergency therapy in settings where opioids may be present. Narcan nasal spray is not a substitute for emergency medical care. Important safety information. Narcan nasal spray is contraindicated in patients known to be hypersensitive to naloxone hydrochloride. Seek emergency medical assistance immediately after initial use, keeping the patient under continued surveillance. Risk of recurrent respiratory and CNS depression. Due to the duration of action of naloxone relative to the opioid, keep the patient under continued surveillance and administer repeat doses of naloxone using a new nasal spray with each dose as necessary while awaiting emergency medical assistance. Risk of limited efficacy with partial agonists or mixed agonist-antagonists. Reversal of respiratory depression caused by partial agonists or mixed agonists-antagonists such as buprenorphine and pentazocine may be incomplete. Larger or repeat doses may be required. Precipitation of severe opioid withdrawal. Use in patients who are opioid dependent may precipitate opioid withdrawal, characterized by body aches, diarrhea, increased heart rate, tachycardia, fever, runny nose, sneezing, goosebumps, piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness, and increased blood pressure. In neonates, opioid withdrawal may be life-threatening if not recognized and properly treated, and may be characterized by convulsions, excessive crying, and hyperactive reflexes. Monitor for the development of opioid withdrawal. Risk of cardiovascular, CV, effects. Abrupt postoperative reversal of opioid depression may result in adverse CV effects. These events have primarily occurred in patients who had pre-existing CV disorders or received other drugs that may have similar adverse CV effects. Monitor these patients closely in an appropriate healthcare setting after use of naloxone hydrochloride. The following adverse reactions were observed in a Narcan nasal spray clinical study: increased blood pressure, musculoskeletal pain, headache, nasal dryness, nasal edema, nasal congestion, and nasal inflammation. See instructions for use and full prescribing information in the use of this product. To report suspected adverse reactions, contact Adapt Pharma Inc. at 1-844-4-NARCAN, 1-844-462-7226, or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.
This flowchart will help you determine how to respond to an emergency where there is a potential for an opiate overdose. If you come upon a person you suspect is a victim of opiate overdose, ensure that the area is safe for you to be in. As you look around, look for blue lips and/or fingertips. Tap his or her shoulders and shout his or her name, or shout, "Are you okay? Are you okay?" Rub his or her sternum or roll the barrel of a pen down the fingernails while pushing. Look for pinpoint pupils, remembering that this is not always a reliable sign. If still no response, call or send someone to call 911. Ideally, you will be able to call from your cell phone and place the phone in speaker mode. Look to see if the victim is breathing. If the victim is breathing greater than 10 times per minute, roll him or her onto the side and stay with the victim until help arrives. If breathing less than 10 times per minute, administer Narcan. If not breathing or just gasping, begin CPR and administer Narcan. Perform whichever task you can first. If the victim is not breathing and awake in 3 minutes, administer a second dose of naloxone. If you must leave the victim alone, place him or her into the recovery position. Upon their arrival, inform the police and emergency medical technicians of what happened and what was done. To place a person in the recovery position, simply bend the person's leg closest to you. Raise the opposite arm above the head. While supporting the victim's head and neck, push forward on the bent knee. Once the victim is on his or her side, place the free hand beneath the victim's chin and open his or her mouth. Once the victim is awake and breathing, he or she will likely begin feeling symptoms of withdrawal, such as nausea, vomiting, and restlessness. These feelings are likely to subside within an hour or so. It is also likely that the victim will try to get high again as soon as possible. Addicts can be extremely manipulative and will say anything they need to in order to get you to leave them alone. It is extremely important that you do everything you can to stay with him or her and prevent him or her from getting more opiates. Encourage him or her to go to the hospital for observation. As the naloxone wears off, the potential to relapse increases. If for some reason the victim is not brought to the hospital by EMS or law enforcement, stay with him or her for at least 3 hours until the naloxone fully wears off, watching for signs of relapse. Call 911 immediately if signs of overdose return. Addicts often resort to hurtful speech and empty threats. Very rarely will their behavior become violent, especially when withdrawal symptoms are present. That said, if you feel that you are in danger at any time, you should leave the area immediately and notify the police. Once the event is over, you will need to fill out the New York State Department of Health reporting form and contact us to replenish your emergency kit. This form consists mainly of demographic information and is completely anonymous. The Department of Health uses this information to help determine where and to whom to push resources most effectively. If your naloxone is nearing expiration, please contact our office as well. You will be able to find a copy of this form in your naloxone kit or contact our office for a new form. Many folks have questions about legal liability. Rest assured, you are protected from civil liability and criminal prosecution for administering overdose treatment, provided it is done in good faith and you believe the person is experiencing a drug overdose. If a pregnant woman is experiencing an overdose, you may give her naloxone. Even if the fetus goes into withdrawal and distress, if the pregnant victim dies, her fetus will also. It is far better to save one life than to lose two. To help ensure that future doses of Narcan are available for anyone who needs it, New York State has created the Narcan Co-Payment Assistance Program, or NCAP for short. If your health insurance plan provides medication benefits, the state will cover your copay up to $40. This keeps the cost to you essentially zero and makes the medication more readily available. Every chain pharmacy in New York State is required to participate in this program, and many independents are enrolled as well. Insurance companies may impose some restrictions as to the number of doses you can get in a month. For more information, you are encouraged to talk to your insurance company and pharmacist. Thank you again for taking the time to learn how to save a life. There are just a few steps remaining to obtain your naloxone rescue kit. Please click on the button below this video to begin your test. You must score 85 or greater in order to qualify for a naloxone kit. You may retake the test as many times as necessary. Once you have passed the test, please fill in the form at the bottom of this page. If you have any questions or need any additional information, please feel free to contact our office at 631-849-4978. That's 631-849-4978. Or email Narcan, at havedummy.com. That's NARCAN at HAVEDUMMY.com.